Cakes, our cameraman operating the jib this morning, showing us what he's made of. Good to have you back. Well, you've been here all along, but good to have you operating the Jimmy Jib. We've missed it. All right, so Health Minister, let's follow him now. Dr. Zweli Mkhize is on his second day visit to the Eastern Cape, where he is assessing the work that's being done at public hospitals to deal with the COVID-19 pandemic. This amid rising coronavirus cases in the Eastern Cape. There has been confusing reports from media houses about the capacity of the province to handle the pandemic and the projected number of deaths during the peak period in the next 3 months. This follows a report released by the provincial government a few days ago. But for more on this, let's cross over to our reporter, Busisiwe Jemsana-Mantashe, who is there in a beautifully warm East London. I'm so happy for you. We're freezing here, but you've got a big news day ahead of you. Talk to us about this visit.
A big day, a big news day indeed, Leanne. But let's first talk about that confusing report that was released a few days ago, where we saw different media houses alluding to, talking about the peak period that we are expecting about 6,000 deaths. Of course, this caused a major shock to people who were following those news on social media, social networks, and that the province does not have the capacity to handle the peak period or more cases come the next 3 months. Of course, those are the things that were written in that report, but we spoke to the health HOD to find out how this is their plans and what exactly does the report mean. And according to him, those numbers are there for when they did not have the lockdown, the stringent measures that they put in, and their plans as the province. But Leanne, let's get the HOD to talk to us about this in detail and explain to us what we can expect in the next 3 months. HOD, thank you so much for your time. And let's talk about what we saw in the report, 6,000 deaths expected in the next 3 months. The lockdown not having to work to help build capacity for the province. What is written there? What do we read out of that?
Yeah. No, good morning. I think in the way how we deal with the preparation for intervention, we do a number of very critical work. One of them is to really monitor the number of new cases on a daily basis, and these are called data sets. And then the second issue is that once you get those numbers, then you plot what is called the model to try and really to understand how the epidemic curve is actually working. Out of that work, you then are able then to create what is called a forecast that assists you with the interventions. There are really two critical issues, three actually. One, the lockdown has worked. And the reason why it has worked is that if you had not done the lockdown, the estimated 6,000 people who would have passed on are really a function of a no action, no lockdown, no stopping of school, no stopping of work, no stopping of travel, no social distance, no washing of hands, no wearing of masks. That would what the Eastern Cape would have been over a period of 3 months or so. Now what has happened is that the lockdown has really pushed the curve. What that means is that the lockdown has really reduced the number of surge of numbers that are actually coming up. And that has really flattened the curve. The three things that it helps us with is that it allows us to build the system in order to respond. That's number one. The second one, it reduces the number of people who could have not have had a care and being supported, and that would have resulted to the high number of deaths. The third issue is that it allows us to learn what are the best examples of how to respond with the lockdown. So basically then what has really happened after the modeling is that we understood what are the push and the accelerators for the epidemic, and we also understood what is it that we can break the epidemic and slow it down. And we are using a number that is really the raw, which is really a reproductive number. This number tells us what each individuals affect, in fact, how many secondary individuals. And really our strategy then is to make sure that the numbers don't go up in order to overwhelm the health services. The health services pitches up and work very hard to actually build the capacities, and at the same time you make sure that the intervention of a lockdown reduces the transmission. So we are actually saying that that is a pessimistic number. We are actually looking at a less, kind of much more numbers, that is post-lockdown numbers that we could deal with.
And when you talk about the lockdown having worked, we're moving forward now, and unfortunately you're chasing a moving target. We're seeing the numbers going up. With the ease of the lockdown measures and regulations, the opening of alcohol outlets and everything that is now being opened, will that still work for the province moving to the peak period in the next 3 months?
Yeah, what South Africans need to understand, and actually the province is doing, is that most of the work now of reducing the numbers is really a matter of what is called social behavior. If we stick to the wearing of the mask, for instance, I should be wearing my mask to protect you, and you are wearing the mask to protect me, and we keep this distance and we wash our hands. Those interventions are quite effective. The second biggest intervention is that if you become ill, you stay at home so that you don't go and infect other people. What we know, the numbers are going to grow because every infected person has a potential of infecting another person. The other person, unless he keeps to these regulations, is not able to be protected. What we're trying to do, we're keeping these numbers very low in order not to move very fast. And really, the mathematics of this number is really just like if one person infects 3 people, in the first round, the second 3 people infect other 3 people, so you've got 9 people. The other group has infected another 3 people, you've got 27 people. And that creates the kind of exponential growth. So we are trying to keep those numbers so that no one is infecting more than 2 people and keep the numbers low.
Perhaps, Doc, in trying to keep those numbers down and making sure that people don't infect more people, you would need to deal with the delays in the issue of labs, test results coming back. And the last time we spoke, the issue was the shortage of mixers at laboratories. How are you dealing with that? Because in order for the province to move with speed, you need to detect and get the results and actually start contact tracing as soon as possible.
You're quite right, because part of our strategy is what is called trace, test, and isolate. And therefore, results are very critical in actually doing that. The province, together with the national, have changed the strategy to what is called a targeted testing. So what we're trying to do, we're now starting to understand that there is clusters of people who are actually infecting others. It's literally like there's a big pond with a lot of fish. So we're trying now to make sure that we're following where the pond is, rather than just putting the thing everywhere or something like that. So we are starting to be really targeted in our testing. The laboratory problems in terms of the testing, we're going to be rationalizing the use of the test, because we understand the test and the test material that are being used are scarce resources. So our priorities is people who are sick, so that we test and treat. And our priorities is close contacts, so that we test and isolate. And our priorities is to make sure that our healthcare professionals are in the system, they are supported, and we know very well when they are protected. So this is what we are doing. And we are very pleased that the National Laboratory is working very hard to get these tests. Province has got a capacity up to 7,000 tests a day. We think if we have those capacities and they are working very well, we've got the reagents, we can actually manage to bring the numbers down and keep the curve and allow the health systems to really prepare, and so that more people are actually supported much earlier.
Lastly, Doc, another issue that perhaps you'd need to deal with is that as we move forward and the numbers are picking up, education at a hospital facility levels, because we've had a lot of outcry from staff members who are saying 2 people have tested positive, the hospital has not closed, and when hospital sections close, still people are scared, they are panicking. What do people need to know with that regard?
Yes, I think this is something that we all are now accepting, that I think the fear and the levels of anxieties amongst our team is a real one. And I think the fact that people are unsure about how the infection is going, we're spending a lot of time in actually trying and providing a psychological support. And we've gone one step further. We've set up what is called occupation and health and safety. These are really individuals that are labor workers and everyone that sits together. They look after their own safeties and make sure that the systems that is put in there is working. And then we went further to actually improve the infection control. So we are actually literally telling our staff now, don't go into a COVID ward unless we are properly dressed. And we're making sure that we're ramping up all the PPE. The PPE is an extremely important, essential tool to protect health workers, but it's a very scarce tool and we must actually rationally use it. There is an appropriate PPE for each one of the risk areas, and we want trying to make sure that everyone understands that and we use it appropriately. There is still a lot of infection in communities. We're really asking all our people that stay within the thing of wearing your mask, keep your social distance and wash your hands, because that's really where you are likely to get an infection than actually in the setting of hospital, because there's more heightened awareness of infection in hospitals than in our communities.
Doc, thank you so much for your time as Superintendent General of the Health Department in the Eastern Cape. Well, Leanne, like the Health Minister said yesterday, the clouds are gathering and we all need to move with speed. Bring health workers, communities to the system so that everyone, as we move, understands each one's role to play, especially communities, in making sure that they keep social distancing and keep safe at all times. For now, though, let's take a quick break. Stay tuned to Morning Live.